okay, new section. All right.
All right. Uh,
Okay. Let me expand this.
you can
Yeah.
see my screen, right?
Yes.
So I've got couple of screenshots of the old system, and this is how basically the assessment looks like.
Yeah. Okay.
And each of this section, when there are three crosses, it means there are three different subsections into it.
Okay.
And
That
the
makes sense.
red indicates that particular section is missing. And if it's completed, it's a green tick mark.
Okay. That makes sense.
So this is basically how does the assessment looks like: demo, history, current medical environment, medication. Examination has a whole lot of different subsection.
Right.
So this is the screen of examination.
Okay.
So it's a head to toe complete examination, cognitive, mental. Again, all these have three different subtabs. For
Okay.
example, if I click on cognitive and mental, it might have cardio, pulmonary, and there is one more. I
Okay.
mean, each of these has different assessments. And for example, this is the history. So here, if you click on history,
Yep.
that's how does this layout looks like. History has three different subsections: medical history. I mean, you have received the history from related to client, frail, compromised. Then surgeries and events.
Okay. Now that goes right now when I think about the what's in Relify right now, that matches what I see on the other side, right? In the
Uh,
Relify, in the
no,
web based, in the scheduling stuff we're on there. Like I have surgery. I can enter in surgeries. I can enter in events. Yeah, click on me. Yeah, click on that
some of them matches. For example, if you go to a client and if you go to assessment,
assessment. Yep. Go to
uh,
nurse assessment. Okay.
no, this is very basic.
No. Go to not going to be here. Go to history.
Okay. Here you see surgical
Yep.
history.
Surgical history. Yes. Put
Yes.
that in here. Okay. And then the other
Yes.
one was
So here
what?
you have this filter is you have allergies, this medical history, all this is required. But thing is here we have medical history just a text box.
Yeah.
In the mobile app, it's more like a detailed way. For example,
But
how it is related to the client, more questions basically. And
shouldn't there be a tie to those? I mean,
it is
yeah.
connected. It is connected.
Okay. Yeah. So what you're
Whatever
saying,
the
you guys you
whatever
guys
the
you guys developed that out a little bit more down the road. It looks like then, right? Is that what happened?
right. So
Okay.
what we did is when the Medicaid again, this is all related to the state of Georgia because that's how we were able to develop it.
Okay.
So we reached couple of agencies and they sent their paperwork to us. How does their initial assessments looks like? What are the fields they have? What are the fields they don't have? Based on that, we designed this app.
Yeah.
So those forms are converted into this screens.
Mm-hmm.
I would like to. I have one more screenshot. Yeah, this is a skilled nursing,
Yeah.
and basically there is one more screenshot. Just a minute.
Do you have like screenshots of, okay, let's click on visit and or on the next one, what's the two things like vitals and vent settings, the two X's? I would imagine
I
there's
can
two screens inside of there as well, right? And then the other one's
I can get that.
yeah.
That's not an issue.
Okay.
But the wow feature they had was just a second. I'm looking for one more screen. He shared with me. I'm sharing on WhatsApp. So there they have this reporting thing. In one click, you are able to generate this 25 reports. Let me share.
Hey, when you sent over your invoice to Sai, did you get paid yet?
Yes, one invoice I shared that was paid, and yesterday I shared one invoice from the last 2 weeks,
Okay.
so which is due. So this is the reporting screen. So it has all around 26 reports.
Okay.
Advanced directives, appendix, client's responsibilities, cost share, HIPAA notice, and all
And
these things.
all those are forms basically that have been created, right? And so you click on them.
So basically whatever the data you enter here in this section,
Mm-hmm.
it goes into the reports. So the functionality is you select all and click on download report. So
Oh,
automatically
okay.
all
Yeah, yeah.
this
All that information you collected along gets put into these needed places. Yeah. Okay. I
with
remember
with the
I remember some of this was done in Relifi. It wasn't complete yet though.
yes.
Okay.
So uh, as soon as you generate these reports, it saves into the client's document on the website.
Uh-huh. Okay.
So the data is sent in that way. So there are around 26 reports. Basically, the nerds just need to click on one download report, and all these 26 reports with client signature, nerd signature get saved into the client's document section.
If you logged into the have they given you access to the Azure account to look at the Relifi code? Have you have access to see that yet?
Uh,
Your old
yes,
code.
yes, yes.
Okay.
I've got that. Yeah.
Okay. So, if you could look in and find what you have there, and see what may be missing in this,
Mm-hmm.
because I think it would probably be best to have you spearhead this instead of having those guys try to, his team develop all this in theirs. It
Mm-hmm.
seems like since you guys have done this here, that this would be something we would want to have your development team do. Now your team obviously did not do this, so you're going to have to train them to, get them going on all that. Do you feel like it's something that could be done relatively? Um, Obviously, this is not a phase, a phase.
Uh, uh, Once we'll stop the recording, I will say one more message to you.
Okay, all right, sounds good. Yeah. Let's keep going. Okay.
Let's complete this conversation first.
Yeah.
So, in existing Relify, you have this supervisory visit thing, I believe. Supervisory visit is completed, but again, there are a couple of fields which are required by the Medicaid. So when the audit comes, they require certain things. I think we don't have that in Relify because it's something we developed in 2022, 2023. But I can get to those things. What are the things required? And also, it would be great if we can onboard, an RN who, or if you already does, you have the forms, right? Assessment forms.
The assessment forms for when we do
Uh,
like our onboard, like our assessments. Yeah. We have, but here's the issue is like every single agency kind of has, based on what the state requires, right? Some different
yes.
assessment stuff. So I think what we want to do is we want to have a standardized form, that is
Yes.
in a system, and then give them the ability to customize, and add some things onto that. I'm not sure how doable that is since it's in the app or whatnot, but what are your thoughts?
It's doable and it's mappable as well, and it's very much required.
Okay.
Uh, the the reason is these screens are very well fulfill the needs for the state of Georgia. But for Utaha, sometimes the fields are slightly different. More or
Now,
less,
so just so you know, as far as Medicaid, what's interesting is we only have probably the state of Oregon, state of Washington, Pennsylvania. Nobody in Georgia is doing Medicaid, and maybe
Mhm.
one other state. We only have 4 states where we're doing Medicaid. Now we're looking at doing it a little bit more in other states.
Mhm.
But Medicaid, I know that was a big part of what you guys did in Georgia because of what whatever, but
Mhm.
most everything we're doing is private pay and long-term care insurance, which still needs
Then
nursing assessments, right? So yeah,
then in that case, it would be a much simplified things
yeah,
because you don't have that much, you don't require this much detailed.
yeah,
So
yeah.
what you can do is you can share me the documents of long-term care insurance assessments you guys
Yeah.
are doing for and private pay clients, and I can go through the database and from the existing code and figure out what works and what we can
So
add.
yeah, so what we did is we just signed. It's pretty cool, Patrice, what we've got going on. So we have this other thing called the Nurse Loop Referral Portal, right? And so
Mm-hmm.
we have right now one signed agreement with one long-term care insurance company where we've
Mm-hmm.
created a portal for the claims department. When they have somebody goes on claim, they're going to send it to us, and then we will send our nurses out, and we've created a nurse assessment that the insurance company wants for that carrier, right? They go
Mm-hmm.
out, they do the assessment, it comes in, right? That then was what's used to make the plan of, that goes in to make the plan of care,
Mm-hmm.
and then once they come on, then we'll push, that's in this referral portal, and then we push it into Nurse Loop. It's on there. We're about ready to sign with 4 other large insurance companies. One of them does $10 million a day in claims. I mean, it's a massive tens of thousands of calls, and so it's going to be this TPA is a third. Usually they've been going to like a third party clearinghouse to do all this stuff.
Mm-hmm.
They're
Mm-hmm.
going away with that, and we kind of broken the mold, and so it's pretty exciting stuff that we'll be able to, and each one of these carriers will have their own assessment, right? That'll go in there. So we'll keep you in the loop on that as well. So
Sure. Also, do send me the access of the referral modules that you guys have created. I'd like
okay.
to have a look as well.
Yeah. Yeah. And those are set because they're in a different platform. It's called the Nurse Loop Referral Portal. It's a
Mm-hmm.
little bit different, so we still haven't connected those into the others. So it's going to be a little bit different. In fact, it's funny because Cy and his team think they've got it figured out, but I'm going, yeah, no, we still have missed the mark a little bit, but anyways.
Right, right,
Yeah.
right. All right. That's about this. Now, you want to talk about the VA billing and Medicaid billing, right?
Yeah. And I'm going to show you kind of what I ought to see if my daughter will jump on here. So here's what we've got going on with my daughter in Boise. So
Mm-hmm.
in Idaho with her VA, so she'll get approved for respite.
Robert, I cannot hear you. Your audio got disconnected. No, I cannot hear you. No, I cannot hear you.
Hold on.
I can hear you. I was able to hear hold on, but speak something.
Hello, 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 hello.
Yes, 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 yes. And now
Okay.
again got disconnected.
Oh, we're disconnected again?
No, no, no. I can hear you. Go ahead.
Okay, good. Okay, okay, so let me see if I can get my daughter to jump on here as well. Let me give her a call. Okay, so like she'll have, geez, Elizabeth. So she'll make a schedule for like 1 hour
Mhm.
for respite. Hey, busy?
Hello.
I'm on with Patrice in India. We're talking about the VA, stuff. Are you
Yeah.
available to jump on right now to my Zoom?
I can in a few minutes.
Okay, yeah, okay. When you can, just jump on. It's just join a meeting, and it's my cell phone number, and I'll let you in. I'll just fill him in, and when you can get on, that'd be great. Okay, bye. Okay, you hear me, right? Okay,
Yes, yes.
so she has lots of clients that have, like, the VA says, okay, we're going to give you 1 hour of a bath aid, and all
Mhm.
we want is for you to record in that 1 hour is bathing. We don't want to see anything else. We just want bathing. Okay. And then they also have, let's say, 3 hours of home care services, regular home health services, right?
Mhm.
And in those times, they may have these 4 things that they want to do. They don't want housekeeping, they don't want dishwashing, but there's other things that are in there, right? Okay. So that day they have 4 hours, 1 hour for bathing, 3 hours for the other, and then they may have a long-term care insurance policy as well, right? And so
Mhm.
that long-term care policy, oh, can you hear me?
Yeah, I can hear you. Go ahead.
The it may that may be another 4 hours. So the shift is 8 hours. So
Mhm.
in Access Care, what she does is she creates the authorization for the schedule for the 1 hour.
Mhm.
Then she creates another schedule so that'd be from 8 to 9, and then from 9 to 9, 10, 11, 12, 9 to 12, the other one, and then from 12 to 4, the long-term care insurance one that's authorized. And because they are back to back to back to back, Access Care says, hey, link those together and create one shift for the caregiver. So the
Mhm.
caregiver will clock into that one shift. At the end of that shift, it will then basically automatically kind of end it. And so that the caregiver doesn't know this is going on, but the caregiver records, okay, I did my bath, and then they may do housekeeping, they do all those things, the bathing, dressing, transferring, all that stuff. But
Mhm.
when the caregiver clocks out, it then breaks it up into 3 different invoices. One for the first shift invoice, one for the second shift, and then one for the long-term care insurance. And then it knows to bill them all separately and in there. But the scheduler does not have to go in, and then do approve 3 different shifts. Now they may look at it and make sure that, hey, the bathing is, that it's all being recorded correctly the first few times, but once they're confident that it's been adjudicated and whatnot, then anyway, so that's what Access Care is doing. Not that that's what we have to do, but what we don't want to have to do is have the caregiver clock in and out 3 different times.
Right.
Okay, so what's your solution to that kind of situation?
We already actually I worked on the similar solution. In Medicaid, there is a scenario of a split invoice. So split invoices, basically in Medicaid, let me show you the screen so you would understand.
Yeah, I remember we've done split invoices for long-term care insurance where it's like, hey, insurance company's only going to pay for 4 hours, everything after that, private pay. So bill the whole thing, but make sure you build just the private, the other stuff. But we're talking about different ICD-10 codes for this and that, so let's look at it. Yeah.
So in Medicaid, we have this client responsibility per month, right?
Yep.
That means from the first day of the month till this responsibility gets covered, this particular amount will be paid by the client,
Yep.
and the remaining amount will be paid by the Medicaid. So
Yep.
the scenario is, for example, let's say client responsibility is $100, and if uh, um, the agency bills from 1st to 15th, then from agency perspective, they are able to generate, they will be creating only one invoice. But in the backend, the system will split the shifts into two invoices, one for the client, one for the Medicaid.
Mhm.
So first $100, the hours for the first $100 will go into the client invoice, and the remaining will go to the Medicaid.
But the first $100 still has to be sent to Medicaid to show that, hey, those services were performed, right? And that they don't
No,
pay them.
f-
How does
first hun-
Medicaid know that that $100 worth of, or let's say it's $25 an hour, right? And there's 4 hours, so there's $100. How does Medicaid know that we provided 4 hours at $25, whatever? How does it know that?
Right. So each client comes up with the fixed amount. For example, this client has the responsibility of $3,000. Total Medicaid amount that can be billed for this client is $3,000. Let's say. Now, Medicaid system, I mean, the Georgia state system clearly defines that $100 is for the client and $2,900 is for the Medicaid. So the if you submit the claim of 3,000, more than $3,000, it will deny the claims. The claim will not get passed through from Carify to the state system.
Okay, that makes sense. I understand what you're saying, but how do they know? Like I'm saying, if they're only going to pay, okay, if they've been authorized for $3,000, okay,
Mhm.
okay, but the caregiver must pay 100 of it. So I guess they've been authorized for for 3,000, but not the caregiver. I'm sorry, the client needs to pay 100 of that. So they're only going to pay 2,900.
Right.
So, but don't we have?
Beyond 2,900, the claims gets denied.
So okay. So what if we only do $2,900 in a month? We don't do 3,000.
Then that's the loss because Medicaid has approved for 3,000 and there is a client responsibility. So it's like when you generate the first invoice, it is always paid by the client. Then the Medicaid comes into picture.
But don't you have to show some type of proof to the Medicaid that you provided the first $100 or worth to the
Yes,
okay, so
yes.
you are
Because
submitting that. You are
because
submitting that.
all the shift information goes to the
Okay.
EVV system directly.
Okay. That's what I just want to make sure. Yeah. Then we're on the same page. Okay. All right.
Yeah.
Hey, Busy, let's show, hey, Patrice, this is my daughter, Elizabeth. We call her
Hello,
Busy.
Elizabeth. Hi.
Hello.
Hi.
Nice to
So,
meet you.
Same here.
so she used to use Relifi back when she was in high school working for me back in the day. So she's a little bit familiar with it, a little cobwebs, but Busy, can you share your screen? And I want you to show what you're doing with Access Care and the VA, like for the 3 different types of billings and stuff like that. And then explain why you're doing it and whatnot. Okay.
Yeah, similar to the video we recorded yesterday,
Yes, like that. Yeah.
the other day. Okay, I can do that. All right. One sec while I get logged into that.
And then can you share your screen or do I need to give you authorization? I think everybody has authorization.
I think I should be able to share. All right, so it might not be as clean as it was when we did it before, just because I'm working on only one screen this time, but all right, can you guys see my screen now?
Yeah.
Yes.
Okay. Perfect. So what we've kind of been experiencing with VA billing up here is that we have three different VA services that we're able to provide. There's Respite, HHA, and then Homemaker. And in Idaho, where we're providing these services, they have certain, within those authorizations, only certain ADLs are approved. So for HHA, it's only used as a bath aid service. Homemaker is only for light housekeeping, errands, transportation, that kind of stuff. And then Respite is you're not supposed to be providing much beyond just kind of being on demand. So you're not really supposed to be doing any kind of bathing or anything, what they would consider extra. And so they don't want to see those things reported on the like billing when we send invoices. They don't want to see those ADLs reported. But, a caregiver in a given shift is going to provide all of those services.
And busy. I guess, like, I was talking to some of the other VAs throughout the country.
Mhm.
Some of the other VAs, when they submit their billing, they don't have to submit any ADLs at all.
Oh, interesting.
All they have to do is submit the time, the date, time the caregiver is going, and the code that was on there. So Patrice, have you found that to be the same as well on VA billing throughout the country, that some of the VAs just require the billing code and then the start and stop time and the caregiver that was there and whatnot?
Yes, Robert, I believe so, because the tasks were never the part of VA billing. Only the codes and the hours, those information goes to that VA form 15, I believe, if I'm not wrong. There is a
Yeah. So
yes.
in some of the VAs, like Idaho's VA, those everything you're talking about needs to be there in addition to the ADLs that are approved. So that's one thing we're going to need to look at, for each different VA that's on there. So busy, show like an authorization, how you would set up like an authorization for for like bath aid.
Okay, so say we got a referral from the VA saying, hey, Mr. Johnson is approved for 3 hours a week bath aid services. What that looks like, you're saying?
Yeah.
Okay. So we receive it via fax, and then there's a full document that we're given, and that document has codes that I need to copy into it. So whenever we get that fax, I would come in here and I would attach the it's called a 107080 is the document that has the authorization for the VA services. And so I throw that document over here in the documents. Paradigm as a clearinghouse requires that we have that form. So it needs to be on the client's profile. Then I go into billing and I would essentially copy over the codes that are needed. So in here, I have already added some, but I'll show you what it looks like when I add it. So I pick TriWest as the payer source. And then for authorization code, I would paste in what the authorization code, which would look like something like this. And then this veteran has bath aid or homemaker, or sorry, HHA. And so I add that in. And it's 3 hours a week. So I adjust this here. And then I would put the start date for the authorization. Let's say it's today. And it goes usually for about 6 months, although I've seen some be approved for less, some be approved for an entire year. But yeah, then I would throw the day that it ends in here. And then I save that. So here we have I guess this just added another one on here. I didn't already have HHA, but I would be able to throw in as many as this veteran has. So if he has HHA and Homemaker and Respite, then I can keep track of all of those authorizations separately, which is important because some VAs put Homemaker and HHA together, but ours keeps all of them separate. And they all have different bill rates too. So this one is like 40/20, and this is 60/20, and this is 60/20. And then this home care is listed as 37/50. And
And
so
they bill in 15-minute increments as well.
yes,
So-
the VA bills in
Yes,
15-minute
yes.
increments.
Okay.
So that's how I would add an authorization. It doesn't, I don't think it tells me when authorizations are going to expire, or anything like that. So when I go to build the schedule, which I can show you how I would build a schedule for this client that has 4 different services being provided. When I-
So first of all,
Yeah.
go into and like show the plan of care that you have for that client, right? And put what goes on there. So like for us, we like in Relifi, we go and we do all the stuff that's on there, like for VA client, and it's bathing, dressing, transferring, toileting. It's a PRN or it's mandatory. So she's gonna do
Okay.
that.
Yeah, I can show you how to do that. So once I put in that authorization, he's got all of his authorizations in there. Then I would create here it's a form, where I make the plan of care. And I have to remember which one I liked. Okay, it's this one. So then I would go out and do an assessment for this veteran, and then I'm basically just copying all of my notes from the assessment into this part here. And so for us, we use an online, we use Sign Now, and so I would just copy paste from.
That's fine. You're good. That's too
Yeah.
granular, but just go ahead. So you make the
Okay.
plan of care, that's on there. And so us in Nurse Loop or Relifi, we're going to do this very similar type of stuff right here. That's going to be on there. And I kind of think of this more like a facility shift, what she's going to show you here. On facility
Mhm.
shifts, you can then say, okay, here's the plan of care, but now on this one, we're going to throw this and we want to throw this. And we want to, pick from that plan of care.
Got it.
So
Okay, so I just updated these ADLs so we can do something later on. Then, okay. So yeah, I'm doing my plan of care here. I would put in any other details, and then, yeah.
don't worry about that. We just wanted the tasks for what the caregivers are going to do,
Okay.
right? So
Mhm. Which you can also do that in a separate thing. So this is plan of care form, but you can also just throw in ADLs here as well. Like there's 2 different spots that you can do it. But anyway, so build the schedule now, you're saying?
yes, build the schedule. Yeah.
Okay. So this veteran has 4 different services now, right? So we're gonna start with HHA, and this is called chaining visits. So I'm just gonna keep it simple for us here. Unless did you want to show the clocking in and out as well, or you just want to
No,
show the
just
setup?
show it. It will just show set up how it goes. Yeah.
Okay.
And
So-
then you can manually do it as if they did it, right? And so we'll just
Yeah,
pretend
yeah.
like it. Yeah. So do it for a 1-hour visit, like a normal one would do. Don't do a 3-hour or don't do a 15 minutes. Do like a normal schedule.
Okay. We'll do this here. So the service, all of that. Now one thing that I found recently that I like, you can pick here, like if you just click the service off of this, it will automatically put the start and end dates for that authorization, which is nice. So it's not going to build a schedule that goes beyond what the authorization is. It's just going to throw it in for that authorized period, which helps me
And-
keep track of it.
You are not allowed to schedule beyond authorizations, otherwise you won't be paid.
Yeah, right.
Yeah.
I don't want to miss that without the renewal.
Right.
Helps me know when I need to follow up with the social workers. Here I can adjust what ADLs are going to be on this specific visit. So because this is their bath aid, HHA, and they don't want to know about anything else happening, I'm going to take off every other ADL, and I'm just going to have these 2 on here. And this is all that's going to be reported for this 1-hour shift. So I'm going to go ahead and save this schedule. So I've got my first one, then we're going to go ahead and pick the second one. We're just going to say it's going to be the homemaker one. And then the last one ended at 1 a.m. So this is gonna go 1 to 2. And I'm gonna adjust the ADLs. This is homemaker. And so all that needs to be on this one is that light housekeeping.
This is kind of like how I figure like how we do facility shifts. Like we go in there and we kind of like randomly pick what we want, you know what I mean? From the plan
Mhm.
of care.
And then my next authorization, that's gonna start 2 a.m. to 3 a.m. And this is respite, so everything can be on here except they don't want to know about bathing because they consider that a little bit, that's a different service, and the light housekeeping because that's a different service. But everything else will keep on here. And that should
And you
be
would never want to duplicate because when the caregiver clocks into the shift, though there's 3 shifts, to her it looks like 1 shift. And so you'd only want bathing on there once. You wouldn't want it on there 3
Well,
times.
you can report bathing several times because when we go in, so now I'm doing our LTCI.
Mhm.
The insurance wants to know everything. And so for this one, which starts at 3 a.m., right? We're at 3 a.m. now.
Mhm.
I'm not going to adjust any of the ADLs. I'm going to keep all of them on there because all of them are part of the care and all of them need to be done.
But if you've already put it on there for like 2 hours earlier, wouldn't it already have been on there?
Well, so the ADLs stay with the client, right? I'm not removing anything. It's still available here. And the fact that it gets reported on a different authorization doesn't impact this other one.
No, what I'm saying is, but when the caregiver clocks in, they're not going to see, they're only going to see it once on there, even though
Yep.
they could, yeah, that's what I'm
Yeah,
saying.
yeah. The caregiver sees the complete list of tasks for that visit. So if there was bathing only on Wednesdays, we could set it to where there's only bathing available on Wednesdays and there can't be bathing
Well,
reported on the other days.
correct. No, what I'm talking
Yeah.
about though, Busy, is like you've created 3 or 4 shifts and you've given some tasks to certain time periods and others. And so on the last one, if you're just going to throw them all on there, well, you've already got them assigned to the 2 others. It's only going to show up there once, right?
Yeah, the caregiver's only going to see it once.
Okay.
Okay, so we've got our schedule built here. And then when we go into the calendar now, this is how it shows up here. Let me take off bar. I don't want to see deleted ones. This is what the chained visit looks like for us. So we can see each of the different, I have a setting turned on so that I can see the payer source and the service. So I can see I have my HHA, homemaker, respite, and LTCI, and they're all back to back. And so I've also turned on a setting in our system preferences to where it shows up as only 1 shift for the caregiver.
Put me on the,
Got it.
put me as the caregiver on there.
Mhm. Oh, sorry. And while he's getting that pulled up, I'll show you. So on each visit, I can see the kind of service that it is. And then when we go in here, why does it say no ADLs assigned? Interesting. Okay, well, on this one, you can see bathing shows up on our HHA. That's the only one that shows up besides the plan of care acknowledgement. And then for our homemaker, it's only going to show up for housekeeping. And for respite, everything except bathing and housekeeping shows up on here. And then for LTCI, we have all of it on there. I don't
Okay.
know why it's different on this one.
So in the mobile app, the caregiver sees all the tasks at once, or depending upon the time
So,
they're
so
able
I'm
to
gonna
see?
show you now. She just put me on there, right? And so I'm looking in the caregiver app and it is showing here. I'm gonna just screenshot this and put it in producer. I'm sending this to you in WhatsApp. Okay. Okay, I just sent it to you.
Got the screenshots. Okay. So in the caregiver app, okay, there is one.
So
So as a,
even though, see there, even though there's only one shift, so the one that just says Boise office Amada, no clock in, clock out, right? You can see it says 12 a.m. to 4 a.m. And so it only shows it as one shift. And then
right.
when I click on that, then it'll show, then if I click on ADLs, that's when it shows that this one right here, you know, where I can see activities, bathing, dressing, transferring, housekeeping, you know.
So basically from caregiver side, they have simplified it. So the caregiver just have to record the task. But from billing perspective, they are able to identify this particular task will go into VA Homemaker, and that's how the claims should go.
Yeah,
That's good thing.
so it's going to create a single invoice for the first one, then another invoice for the next one, and another one there, you know what I mean? So they're all separate, you
So
know.
technically, I mean, from the admin side, it's a 4 different shifts but from the caregiver side, it's just a single shift. So
Yeah.
because they got it. I mean,
Yeah, and
that's
you can set it up ahead of time so that the schedule already has it split by authorization. Because for a while, we would have to look at a 4-hour shift and then manually go through and create 4 other shifts or 3 other shifts off of that first one, and it gets messy.
Which then the caregiver
So-
sees all of a sudden this stuff in their app, right? You know what I mean? And it's like, what's going
Yes.
on? You know, it's really confusing.
So one more question to you, Elizabeth. What happens if the caregiver forgets to clock in and clock out? In that case, as an agency, you clock them in 4 times with 4 different shifts, or you clock them in only once?
So I believe you only have to clock them in for the first one. So if the caregiver forgets to clock into the first visit, and then doesn't realize it until, in this case, it would be 1:30 a.m. Then I believe we would have to clock them in from the first shift. Because once the caregiver clocks into the first one, it automatically will clock them out and into the next one the whole time. But if they forget to do it until the middle of the shift, I think we have to go back and start it from the very beginning. I haven't had too many experiences with this yet. So I haven't had that specific case happen, but that's my understanding at this point.
Then, yeah, I mean, that's the very easy way for the caregivers to do the shift and for the agencies to manage the billing. I like this approach, Robert.
Yeah. Okay. Good.
Yeah.
Now the thing is, like, our authorized, I can't remember because we didn't do a lot of VA stuff at that time. Like, we have a VA plan of care, right? And so when when we build our schedule for that caregiver, it's based on that VA plan of care, you know, and so how would we change? I guess we would basically go, okay, we have the VA plan of care, and then if it stacks right back to back after that with a long-term care insurance one,
So I think the primarily change we need to do is right now the shifts are not associated with the authorizations, whether it's LTCI shift or a VA shift. So first of all, we need to connect the scheduling to the authorizations. That's the first step. And
Yeah.
once that is connected, then the billing will go based on the authorizations. And
Okay.
that's also another problem of the agencies that they do not want to, over schedule a client beyond the authorization hours. That's the
Okay.
major thing.
So let's go ahead and stop sharing your screen, Busy. And Patrice, can you go into RelyFi?
Sure.
Was there anything else? Do you want me to be here for this testing or?
Just a second, just hold on for a second here, so you can, I
Okay.
want you to see this logic here. Click under, so like, under VA,
So here we need to give them the flexibility to add multiple authorizations, just like BC
Yeah.
showed us for respite and others. So once the multiple authorizations is added here, in the add shift, they should be able to map the shift with the authorization. So
Okay.
basically, it's like the shifts will schedule based on the whatever the authorization start date and whatever the authorization end date is within those.
Yep, okay. And so also, you know how she said, like, see, here we have hours approved, and it's hours approved, not units. Now, it's monthly hours, but some VAs are weekly, some of them are hourly, some of them are, you know, so we need to have, just like
Those
it did,
fields.
we need to
Yes.
have, yeah, the flexibility to say, okay, this authorization for this code, you know, and this type of schedule is weekly, this one's monthly, this one's, right? And then it's saved, and then view revision history, then it would also, so click on review, then that would drop under there, and which one would show which ones are the most active ones, you know what I mean? So,
Right.
okay. All right.
So
So here's the thing is, like, I think when I share this video here, again, Andre, you know, when you're watching this with your team, I really think we're going to need to look at, is this something with Petrucia's expertise with the VA and knowing this here, and with healthcare, is this something that we are going to want to right now have Petruce, you and your development, you know, assign this side out to your development team, because already we've got we've got them working on all the other kind of stuff that's just standardized stuff. This here is a lot more complicated, I think, that goes into it, that you may want to oversee this side of it. You know what I mean? What are your thoughts, Petruce? I mean, is this something we'd want to divvy
I
up like?
mean, uh, if you want my team to develop those, we have the resources, and under my, and as I manage my team, we'll be able to develop it. The
Okay.
use
Well,
case is pretty simple, but it starts with the settings first of all, as BC mentioned. In the settings, you need to have the configuration of combining multiple shifts into a single shift. I
yeah.
think in the existing database of RelyFi, it does not have that flexibility. So first of all, we need to have that flexibility in the database of combining multiple shifts into a single shift from caregiver's perspective.
Mm-hmm.
And once the carrier completes the shift, again, from billing perspective, the 3 different or 4 different invoices needs to be created depending upon the prior authorizations on those shifts. For VA respite, form 1500 should be separate. For VA HHL, form 1500 should be separate, and all those things. And there is again LTCI. And to complicate the scenario, you can have private pay as well.
Right.
So the invoicing needs to be separate out.
Well, yeah.
But
The one thing that comes
it
to my mind, especially long-term care insurance, because if the third shift or the fourth
Mm.
shift, because if it goes from VA, long-term care insurance, the invoice then goes over, click on the LTCI claims information tab here, you know. Nope, no, I'm sorry, details information. You know, now it's got to pull in the policy number, the, you know, the, all
Yes.
this information, and it's got to pull from that ADLs that adjudicated it from the, so then it goes from a shift that like, okay, well, we have 4 shifts, but the last one has adjudication built in it for long-term care insurance and the others don't have that. You know what I mean? You know, and so
Right.
there's a very, you know, there's a lot of
Again,
complexity to that. Yeah.
and it from caregivers, they don't care about whether it's the VA shift or a LTCI shifts. They
That's right.
just need to complete their task.
Yeah.
So that bifurcation needs to be done from the admin side itself in the web portal itself. Okay, this is bathing is the VA task. So when the authorization is related to the bathing, that particular task should map with those things.
Now I would say this, what we will probably see 90% of the time throughout is you have a bunch of VA shifts and now the VA is not paying anymore. And most likely after that, they're private pay. There's not a
Yeah.
lot, most of the time it's not VA, long-term care insurance, right? Busy. You know, you may be a little bit different because we're getting some referrals from long-term care insurance. And some of those guys are also veterans that have it in there. But for the most part, my experience of 15, 12, 13 years of doing this, you know, most long-term care insurance are long-term care insurance. And then if the insurance company isn't paying it, they're paying privately, you know, but there may be a niche in there where we got to figure, you know, there might be VA, long-term care insurance, private pay, you know, so, you know,
Mhm.
yeah.
But you might run into VA clients that have multiple kinds of services that are authorized.
Yes, but by the VA, yes, but it's the same payer though. It's still the VA. It's just different ICD-10 codes and different
Mhm.
tasks that are going in, you know. Now, the other question on that, on the VA stuff, so like, maybe you don't know this because you're not involved in the billing. When now we're going to be using Waystar, not, you know, we're going to be moving away from Paradigm because we're going to be going with Waystar. Now, the reality is Paradigm uses Waystar, you know, when they're doing it, you know, it's just white labeled for Paradigm. But we need to make sure that when they take that export, whether it's an API, I don't know, or if it's a Excel that's uploaded and gone, what does it look like when we're taking both ADLs, ICD-10s, time start, time end, client's name, caregivers? You know what I mean? We got to make sure that we're getting all that information over to the right payer source, right, Petrush?
Agree.
Yeah. Okay.
Yeah. And what you were saying, Patricia, about how when you submit the claim, the ADLs typically aren't included for VA. I think that's pretty common. And I think the only
No. It's not common, Busy.
Oh,
You
just
got
kidding.
it is not. There, it's common for you because it's mandatory in Idaho where you're doing your
Sure.
VA. But like in Washington, we don't do that. In Oregon, we never did that. I talked to the guys in Texas, they don't do it either. You know, so
Yeah, I think for our ADLs, it's more about if the like social workers follow up with us about like they will request the care notes from certain visits, is what I'm saying. So like you don't need it for claims, but you do need it for when the social
Compliance
workers and the VA
purposes.
follows up.
Okay.
Right.
Thank you for clarifying that. So you are not submitting ADLs when you're doing the billing. You're
I don't
just
believe
doing it.
so.
Okay, let's get clarification on that.
Mhm.
But I guess the question is, so when they want it, are you faxing over to them or emailing, scanning and emailing over to them the shift notes that show that? That's what you're doing when they
Yes.
ask for it.
Yeah.
Okay. Just like we would when we're doing a survey for Medicaid, for Trush, you know, when they come in and want documents. Okay, gotcha. Okay.
Right.
Okay.
All right.
All right. Well, hey, I think that's the main thing I wanted to go over with you, Patrice, on the billing for the VA. And some of this is cross-functioning as well for Medicaid, you know, in a lot of ways, right? That's on there. That same kind of logic we're talking about. So I'll go ahead and I think we're done with that. Let me go ahead and stop recording.